Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, here to do a Delta variant COVID-19 update for pediatrics for children. This is a really important topic. You know, when COVID-19 hit, one of the blessings of this black cloud was that children were not being impacted in any kind of a scale early on with the wild COVID-19 virus, the original COVID-19 virus. You know, they keep calling it wild, but now that there's questions about whether it was actually ever wild to start with, I guess that's not really a good term. We'll just call it the original COVID-19 virus. The children, fortunately, were being spared and were not. And when they did get the virus, they were not getting very sick. Unfortunately, with the Delta variant, we're seeing a whole another ballgame. Children are getting this virus and they are getting ill. Now, they're less likely to get as sick as adults are, but we're still seeing infants, children, adolescents, and preteens and teens all getting sick, and actually some getting very sick. And there's actually a syndrome now that we're seeing that can happen weeks or much later after the virus, even in children who are not symptomatic with COVID-19 symptoms, but have suffered a COVID-19 infection and of course survived it. They're seeing a multi-system inflammatory syndrome of children. This where their kidneys, their heart, their lungs, their gastrointestinal organs are all getting inflamed. It's a very, very serious illness. So, you know, we're kind of between a rock and a hard place here, because children under 12 aren't eligible for the vaccine yet because it hasn't been tested enough to be able to make that decision. So these children are at risk. So, you know, I know that we've talked a lot about the vaccination and the controversy surrounding it. I personally am vaccinated, as is my entire family, and I absolutely believe in individual freedom of choice, 100%. But I will tell you this: if you've got a child that is below 12 in your household, if the whole household other than that child isn't vaccinated, you're putting that child at risk because they're not eligible for the vaccine. Now, the ideal situation, if you've got a child under 12 years of age who can't be vaccinated, is that for the rest of the household to be vaccinated. That's going to help protect that child from coming down with COVID, because if someone in the house gets infected, and then, you know, obviously it puts them at markedly increased risk to contract the virus in the household. Now, I know there's a lot of talk about the vaccine isn't protecting 100% against the Delta variant, and no vaccine is 100%. But I'll tell you that I'll take my chances with a very, very tiny risk for side effects with the vaccine versus fighting the virus without any kind of protection at all. I've just seen how unpredictable this virus is, and I've seen very healthy people get very sick. And in fact, there was a head of a children's hospital here in the U.S. They had 24 pediatric admissions, actual inpatients with COVID-19, and 4 of those 24 were on a ventilator. Were very, very sick. So I just encourage you to get vaccinated for your children that are under 12 years of age. If the rest of the household's vaccinated, you're affording protection to the children under 12 who are not able to be vaccinated. And if you become symptomatic or your child becomes symptomatic, I encourage you to get tested quickly and get treated quickly, because the sooner we can treat this virus early in its disease process, the less likely that it's going to get severe, the less severe the virus and the infection, or the viral load on the patient, and the less severe the infection, the less likely they're going to have severe complications. So that's our pediatric Delta variant COVID-19 update. Appreciate you watching today. Please be safe, and please take this pandemic seriously. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.